I'll be presenting today's Radiopedia.org case in radiology, Adamantinomatous craniopharyngioma. Case courtesy is demonstrated here, and the case link is in the description below. Presentation: we have a 65-year-old female presenting with increased forgetfulness, a feeling of being slow to respond, and decreased speed and mobility. On CT without contrast, we see a mass lesion in the suprasellar cistern region extending to the anterior region of the third ventricle, causing secondary obstruction at the level of the foramen of Monro, and we see that there's moderate dilatation of the lateral ventricles. The superior part of the lesion is globular, well-defined, and intrinsically hyperdense, while the inferior part of the lesion is linear and calcified. On MRI, we again see this partially calcified suprasellar lesion extending in the anterior portion of the third ventricle. The superior part of the lesion is round and well circumscribed with a hyperintense signal on T1. The inferior part of the lesion is more irregular, with both enhancing solid components and coarse calcifications. The lesion is associated with obstructive hydrocephalus, with dilatation of the lateral ventricles due to obstruction of the interventricular foramen. This case showcases a 65-year-old patient who presented to the emergency room with cognitive deficits, including increased forgetfulness and decreased speed of speech and mobility for the past few days. The patient was initially thought to present with symptoms of stroke and underwent initial CT, with demonstrated a mixed density partially calcified suprasellar mass lesion extending to the anterior third ventricle, causing obstruction of the foramen of Monro and secondary hydrocephalus. MRI confirmed the presence of a mass lesion, and the main preoperative diagnosis was a craniopharyngioma. The lesion also shared several characteristics with a colloid cyst, including high attenuation content on unenhanced CT and secondary obstruction with acute hydrocephalus. However, the presence of calcification and pattern of extension to the suprasellar cistern made this diagnosis less likely. The patient underwent surgical resection of the lesion. Histopathology confirmed craniopharyngioma Adamantinomatous type. Post-surgical imaging showed immediate improvement of the acute hydrocephalus.